Away from galamsey to health issues, data available to UNICEF shows that a lot more teenagers, particularly girls, are increasingly contracting HIV and AIDS infections in West and Central Africa as compared to other parts of the world. Speaking to the Global AIDS Monitoring and UN AIDS 2022 report, UNICEF Chief of Health Alexander Boone said the situation could be attributed to many factors, including a myriad of challenges confronting the sub-region. He spoke to JoyNews' Emefatiamwa Eli in an interview in Lome.
Sharing details of the data with members of the African Media Network for the Promotion of Health and Environment, REMAPSEN, at a workshop in Lome, UNICEF's Chief of Health in Africa, Alexander Boone, said despite advances in recent years, particularly in reducing HIV transmission from mother to child, attention and support for children and adolescents living with HIV remains insufficient. Alexander believes this is among the myriad of other factors aggravating the prevalence of cases, particularly among adolescent girls in Africa. He said girls are at a greater risk of contracting new infections compared to boys.
In some countries where the incidence and the prevalence of HIV is on the rise, we have noticed that unfortunately the majority of newly infected people were among adolescents and particularly adolescent girls. And as we showed it on the graphic, the risk of adolescent girls to contract HIV is pretty much 6 times higher than the equivalent of age of the male adolescent. And that is probably related to many things and many circumstances or behaviors or either social related to poverty, perhaps related to the circumstances where these adolescents live.
Also among the regional challenges compounding the threat to adolescent health include limited engagement of community health workers in HIV and AIDS service delivery, as well as low availability of adolescent and youth-friendly health services in countries recording higher figures. According to the Global AIDS Monitoring and UN AIDS 2022 estimates, West and Central Africa is one of the regions in the world where children and adolescents are most affected by HIV, putting them just behind East and Southern Africa.
We know that girls in general are much more sensitive to sexual transmitted infection, including HIV, than boys. The intergenerational sex is also one of the contributing factors. When a young adolescent or an adolescent girl gets into sexual intercourses with older men, there is a higher risk of transmission as well of sexually transmitted infections, including HIV.
According to the report, prevention of mother-to-child transmission has remained at 65% coverage on the region since 2017. 7 out of 10 children don't have access to HIV treatment in West and Central Africa. Pediatric treatment coverage is at a low 35% compared to 73% for adults. Also, there's been only 25% coverage for early childhood diagnosis, with 3 out of 10 children born to HIV-positive mothers tested before their first 2 months of life. Regarding early diagnosis of HIV in infants, Ghana is among 8 countries to achieve above regional average of 25%, well below the target of 95% in the continent. In a clarion call to action, UNICEF enjoins all and sundry to accelerate the pace towards an AIDS-free generation in West and Southern Africa. The Children-Centered Humanitarian Organization believes eradicating AIDS starts with children. Each country must do everything possible to create a world in which children and adolescents are assured of getting the support they need to fight HIV and AIDS, so we can deliver on our collective promise to enable an AIDS-free generation by 2030. Emefa Ewenam Atiamwa Ellis reports for JoyNews. Lome.
world. I've been joined by the Director General of the Ghana AIDS Commission, Dr. Treme Etwahene, for more. I'm grateful for your time. First, let me ask you how you feel about this.
Yeah, thanks for having me. It is very concerning. Hello, I hope you can hear me.
Yes, very well, Dr. Etwahene.
Yes, it's a very concerning issue. We know that this is the situation across the sub-Saharan African region where new infections are much higher among women and girls. And it is so because of a number of factors. But before I talk about the factors, I would like to clarify that both men and women, boys and girls, and children are all at risk of HIV, but some are at much higher risk than others. And adolescent girls and young men happen to be one of those subpopulations that have much higher risk for HIV. And there are biological, social, cultural, and behavioral factors that account for this situation. And as you are aware, the situation is not different in Ghana. We have more than 4,000 people who got infected in 2022. I mean, young people aged 15 to 24 who got infected in the year 2022 alone. And of this number, more than 80% were actually adolescent girls and young women. And so the issue is an important issue for us as the Commission, and we are doing everything to address the issue among this population.
Of course, Ghana is not it's no exception when we talk about some of these, because of course we're part of the West and Central Africa. But I want you to explain to us how females are actually 6 times at risk in contracting HIV/AIDS as compared to their male counterparts.
Yes. Again, let me clarify that HIV susceptibility changes less on a person's sex or gender than it does on how their anatomy is utilized. And so on that basis, we need to acknowledge that the biological factors are quite important when we're trying to look at the gender disparity in terms of HIV reinfection. And the first point under biological factors is the fact that receptive sex is generally riskier than insertive sex. So whether it is vaginal or anal sex, the receptive partner is more at risk to the infection than the insertive partner. And this is because there is greater mucus area in the woman which is exposed to HIV during penile vaginal intercourse. And if there should be any breach or tear of the vaginal mucosa or anal mucosa, which is relatively thin, there definitely will be an increased risk or likelihood of HIV infection in the woman or the receptive partner if they happen to be a man. And so if this occurs, then we see that is one of the risk factors. Then if there should be untreated sexually transmitted disease, and of course in women, it takes a long time for them to see whether they have any symptoms of sexually transmitted infection. And so if it is untreated for a long time, especially the obstructive ones, it increases the risk of the woman or the girl becoming infected if exposed to HIV. And besides the biological factors, we also have the sociocultural factors. And one is gender inequality, which manifests itself in many forms. And one is power relations between men and women, especially in union. And so that power relation often determines whether the woman can have protected sex or whether the woman can be supported to protect herself by the man. We also have, gender inequalities that relate to access to resources, land, and other related things. So we're looking at the economic empowerment of women, and if many women are poor, then the situation of contracting HIV becomes exacerbated because they will have to find other ways of, having income. And some tend to use their body to raise additional income for their use. And this is where we have sex work. We also have gender-based violence. We see a number of cases that come in the media in connection with sexual gender-based violence, and sometimes it's actually perpetrated by the intimate partners of these women. And all these are factors that, put women at risk of HIV infection. Child marriage is also another important factor. Widow inheritance is also another one practice that we see in our country. And of course, access to quality health care, which usually is affected by our gender relations. In the case of the behavioral issues, the number one is having unprotected sex. And I'm happy the gentleman who you captured in your report mentioned intergenerational sex, which means older men having sex with younger women, older men who are older than the young women by between 5 to 10 years, and sometimes it goes beyond 10 years. And we see this in Ghana, which we call sugar daddy situation, and it's now no longer a sugar daddy situation alone. We also have sugar mommy situations happening in this country. Then we have multiple concurrent partnerships where an individual engages in sex with multiple partners at the same time, concurrently. And then we have serial monogamy. Some of them decide that, okay, they will want to have only one sexual partner at a time, but they keep changing partners within such intervals, and that in itself is also a risk if the sexual activity is unprotected. Sex work in all its forms is a high risk for girls and women. And unfortunately for us, we are seeing different kinds of sex work happening in Ghana. We have the street-based, the home-based, the internet-based, mobile phone-based sex work activities, happening, especially among the young people. Now they call it hookup, and it's also widespread and exposing more and more young women to HIV infection. Anal sex has become a bit fashionable in Ghana, and it's also a factor. And therefore, we need to look at all these issues and try to help the young people, especially young girls, adolescent girls, and young women to protect themselves. And so my point mainly is that when we consider the biological factors, the sociocultural factors, and the behavioral factors, which ones do we have control over as the people? In my view, biological factors, being the anatomy of a man or woman, is something determined by nature. And so in that respect, one can easily give an excuse that he has no control over it. But how we use the anatomy is the most important thing, as I have emphasized earlier. And therefore, we have to accept the fact that we have full control of how we use our genitalia or our anatomy. And social factors and behavioral, they are also issues that we have control over. And therefore, we encourage young women and adolescents especially to be mindful of how they use their body and the need for protection at all times by using condoms at all times that they have them.
Dr. Chayene, this is alarming enough. What has the AIDS Commission been up to in helping to deal with this situation?
The Commission prioritizes adolescents, girls, and young women and their partners in our national strategy. And so we have a prevention program which is comprehensive prevention, where we have combination prevention activities which include prevention that focus on the biological factors, which would ensure that young women have access to condoms, they have access to pre-exposure prophylaxis, for example, to protect them, and that they have the information that will give them the adequate knowledge and understanding of how they can protect themselves. And also giving access to treatment. If they become infected, they have to receive antiretroviral treatment so that they can continue to have a normal life. And so we have a comprehensive program for adolescents and young women and their partners. And in terms of implementation, we are focusing on both in and out of school adolescents, girls, and young women to ensure that we reach out with necessary life-saving prevention, treatment, and care services for these young people all across the entire country.
I understand that you have challenges, Mr. Chayene, that is making your job a bit difficult and also reaching out to the number of people you want to. What are the challenges? Share with me.
As for challenges, there are many. We have challenges that relate to the scale of the services that we need to provide. For example, if we do not have adequate funding to provide the combination prevention services to people who need them, then it becomes a challenge. Number two is that we have, because of stigma and discrimination associated with HIV, and of course, as we are talking about young people, when it comes to HIV and reproductive health in general, there is some stigma related to young people because we expect that they should not be sexually active, and if they are sexually active and having unprotected sex, getting pregnant and also getting sexually infected infections, sexually transmitted infections like HIV and others, then we tend to stigmatize them both in the community and in the home, and also the health facility. And this is an area that we all have to work together to ensure that we do not stigmatize young people, especially in the health facilities, because that is the only place where they can find solutions to their problems. the solution in terms of the knowledge that we need to have so that they can protect themselves and have access to quality health care so that they can have improved health. We cannot deny them these things just because they are young and sexually active. And so there are actual challenges, there are many, but I would like to focus on these two.
You have said before, Dr. Etuahene, that if we are not careful, this will become a state emergency where, it will affect our human resource development. It will affect the people who are supposed to, be part of the workforce to ensure that our economy is sustained. At the state level, what do you want done?
Well, HIV is a productivity issue, and I'm happy that you have put it in the right perspective. It's a productivity issue because it affects the most economically active population. And if we do not protect if we do not reduce new infections among the economically active population, then it's going to undermine productivity in the country, and then it would also affect or negatively impact the economy in many ways. And so, as a country, young people, and here I would say adolescent girls and young women are the people who have to, be trained and become leaders in industry, champions of industry, and if they are getting infected at this age, then the opportunity for these people to reach their full potential and contribute to the development of the country is going to be severely undermined. And therefore, as a country, we need to ensure that resources are made available for these people in schools, out of schools, in health facilities, in communities, and in various social gatherings, so that they will have, we can have a generation free of HIV. And these are the things the Commission is focusing on, so that we can have a generation free of HIV in the country.
What's your your advice to the general public as I leave you this morning?
My advice just to the young people is that they are internet generation, and so they do not know much about HIV. The sanctity around sex and sexual activity is something that they have not had the opportunity to know about. And so if you take a young person who is below, let's say, 20 years, may have had more sexual partners than somebody who is about 50 or 55 years. Why? Because this generation lives in different environments, and their values are different. The internet generation is deprived of a number of benefits that the older generation had. And so this is the realization every young person must acknowledge and realize that it's not everything we see on internet that is wholesome for us, that we should also experiment or practice. We should take our lives into our own hands and ensure that we live healthy lives and productive lives. And so sexual activity, getting into sexual activity at early age is very dangerous, especially for adolescent girls, because their cervix is underdeveloped and the mucosa is also very thin, unlike an adult person. And so their level of risk of infection is very, very high. And therefore, they need to be aware of this and ensure that they protect themselves. The best is not to have sex, at that early age. The best is not to have sex. But if you choose to have sex, then you have to wear condoms at all times, irrespective of whether you know the person, you love the person, you trust the person. Those issues don't matter at all. What matters is that your life is so valuable, is so important, and if you put it at risk, you will have yourself to blame.
I'm grateful for your time, Dr. Chemetra Hene. What's a word? The wise is enough. And that's his advice to Ghanaians this morning. Let's take a